Hey everyone, thank you for joining us today for our COVID-19 update. Today is July 7th, and we're going to bring you a Facts versus Fear 3.0 with Dr. Ikenna here. He's our infectious disease specialist, but first we're going to hit it to Lee for the stats today.
Thank you, Sarah. So appreciate you guys joining us today. As always, we've had a rough go here lately with the trend. It's up. We had over 90 cases over the weekend positive. Fortunately, all but 2 were outpatient. We've done over 10,000 tests to date. We've passed the 10,000 mark in tests. 655 positive tests to date. So not a good trend. We see this happening all around the nation, but we're spiking here too. Well, in a minute, we'll get into some of the areas where it seems to be spiking the most. We have right now in the hospitals, we only have 3 people on a vent in the ICU. Total hospitalized altogether is 16 patients. So it could be a lot worse. And the good news is we're seeing primarily people that are outpatient, a lot of the younger people that have this right now. But anyway, so we have here with us today Dr. Ikenna, our infectious disease specialist who you've seen before. We're so lucky to have him on our team. And we're going to do kind of, as Sarah said, a update to facts versus fears and talk about a few facts. And the first question got for you, Dr. Ikenna, is tell us a little bit about the contact tracing, what you've learned or what we've learned from that.
I suspect you mean contact tracing in our system.
In our system, yes.
In our system. Yeah, actually this work has been done primarily by our nursing staff. I don't know, about 15 of them that were recruited initially. It's been a very useful way to identify who has been involved or who has been affected. And our nurses have done an excellent job. So what they do, they call out these people who are positive, and then they eventually trace who they have been with and provide useful information in terms of how to prevent the infection or the spread, and then provide other help. So that's kind of what's been happening.
So the benefit of contact tracing is education. We saw a very good impact early on in the city of Moss Point, where there was some early outbreaks from people that had traveled and brought it back into the community, and that education from those contact tracers clearly made a difference. And it seems like right now we're seeing it more in Ocean Springs and Pascagoula. Both of those areas seem to be, those 2 cities are way on the rise, whereas Moss Point, it seems like that education and contact tracing is sticking, and they're doing pretty well. So
Right, so those are the main reasons why we brought you back today, because since the beginning you've said this is a new virus, we're still collecting data, there's not really much research that we can go off of, so we've kind of based it off your expertise as to our journey through this. And I know at the beginning there was a lot of fear about the virus being airborne. I know I've seen articles in the news media recently saying that it possibly could be. What have you seen through the contact tracing as far as transmission? How is this disease, affecting
Spread.
people?
whole airborne thing, yeah.
Essentially, I think the contact tracing has practically confirmed what we thought was the case. Most transmission has occurred within homes, groups of people gathering together, and most recently now we've seen all people who visited bars and areas where people go and eat and drink and have communal activities.
Right.
Very little has been confirmed in terms of spread outdoors. I mean, with all the data that's been going around, outdoors is not where people are catching this. So essentially we're back to where distancing is important, masking is important, outdoors is positive in terms of helping prevent the disease, but communal activities, funerals, gatherings, eating, loud singing in choirs and churches, all those types of things.
So if you hug somebody that's got COVID, you're probably going to get it.
Well, that's a
Or if
big,
you shake their hand,
that's a
kiss
big
them.
exposure. That's a big exposure, of course, yes. That's a big exposure. But if you can keep your distance, wear your mask, wash your hands, that's actually how we prevent it. That has not changed. That's something we've learned now. I'm glad you brought the airborne thing. I heard that a bunch of scientists, more than 200, have asked the WHO to declare airborne as important. For those who don't know, airborne really means small particles smaller than 5 microns, 5 mu. We know that you can generate airborne particles when you do intubation, when you put somebody on the ventilator.
Right.
even though this is a possibility, it has to be so minimal that it is probably not worth spending too much time on. Most transmission is still droplet, large droplets, which is what the mask is for. You put it here, and when you speak or shout, things stay within the parameter.
So your girlfriend can't kiss you through the mask?
Well, no.
And,
Not
and if she
really.
hugs you, you're probably not going to get her droplets. in your
Exactly.
mouth.
So this content, it actually protects others from you,
Yeah.
and others within the mask protects them from you.
Right.
In that kind of thing.
Yeah, so the airborne thing's still a bit of a myth. That's not the primary way that it can be. That's not the primary way of transfer.
That is not the primary way.
Okay. What about surfaces? If we were to clean this computer surface after someone touched it, people are still saying that surfaces are still a big part of transmission. Every now and then I hear that. And what's the fact? What's the truth on that?
I will quote most serious infectious disease people will tell you, you need multiple things. You need to wear the mask, you need to wash your hands, you need to clean the environment. No single entity is so paramount. Yes, although the virus can survive on surfaces, it requires you to touch it at the right time, put the stuff in the right place in your face, nose, nostril, mouth, or eyes. So while it is important to clean it, I still think the most important thing is the aerosol.
And don't touch your face. I've
Yes.
gotten very good. And I
In
still
the-
see
in on the
people
droplet.
constantly touching their face. I'm
Right.
like, what are you doing?
Yes.
So,
So
okay, good
those
to know.
droplets, yeah.
All right, so people who are out in the bars and restaurants enjoying their holiday weekend, we're going to see a lot more of the age, younger people, like myself, who, we're out having a good time and celebrating the 4th of July. So what are we supposed to think when it comes to the younger age? Are they going to get more sicker, or are they just going to spread it more? Like, what is our concerns with them?
Well, the younger folks are younger. They're healthier. They have less burden of disease. So that does not make them not be efficient transmitters. So they can still be very efficient transmitters because they can handle probably a much higher load of virus.
Mm-hmm.
But they don't get as sick as the older folks.
Right.
So they will, even if they don't get sick, they're going to bring it home. But having said that, a number of young folks have become very ill too. This is a vasculitis from what we hear now.
Mhm.
So this disease can affect many organs, especially the vascular system. So even though fewer young people are ill, some of them do get ill.
Right, you can
and
be the
seriously
one
so.
in the 100,000 that
Right.
gets a really
And
bad
remember
case.
the report of the children with inflammatory conditions?
Mhm.
Yeah.
And that's was not known a few months ago.
Correct.
So with respect to age then, it's important because those people, while they may fare well, they might not all. If they've got an underlying condition, they
Absolutely.
may not. If they got a high BMI, they might not.
Absolutely.
And we have seen some young people hospitalized.
Mhm.
But the bigger thing is being selfless. Think about others. Don't be that person that infects one of your friends that hugs their grandmother or grandfather or someone who's had chemo and cause them to get it. Don't be a spreader. That's
Absolutely.
sort of the
Absolutely.
age
Right,
range.
my rule of thumb would be if you decide to go and participate in the reopening, be around your friends, be around strangers, then you have to sacrifice not being able to see your loved ones who may actually have a bad
Right.
risk with this disease.
Exactly, we've seen that happen. So what about, one of the things the Facts versus Fears did a while back was this asymptomatic transmission, that everybody's getting it, that it's just everybody you see's got it, and it's asymptomatic people are transmitting it. You want to comment a little bit on that?
Well, I think that statement itself means we have this disease now in the community, and it is impossible to know who has it because not everybody manifests the same
Right.
number of symptoms. And what you may consider asymptomatic, that means no symptoms or no appropriate symptoms. Maybe because you didn't know, somebody didn't check. A little bit of headache, a little bit of sore throat may not be
Right.
considered a symptom of somebody. But essentially, yes, we don't know whether the small percentage
So-
is 5%, 10%, or more.
So when you hear somebody clear their throat, you might want to duck, but you don't know if they had a headache or what if she had fatigue.
Exactly.
So you
Exactly.
got to sort of be careful and
Right.
don't touch your face around
Well,
anybody.
the concept of asymptomatic transmission is actually why we wear the mask. Because before you find out, it may be too late. So we
Right.
say, put on the mask. That means if you have it, you are not likely to transmit somebody.
Right.
Because you may be completely okay today, and tomorrow you
So-
got something. Oh my God! What happened? You know?
So how long would you say, now that we have this more data, does it take for whatever, say I catch the virus, how long would it take for it to be in my system before I start spreading it?
I
She's a
think,
shedder.
right, I think we don't know that for sure. It's probably a couple of days.
Okay.
And that's why they give you, how often they give you a range.
Yeah, so like 2 to 14 days when it first started,
It's
so
a
it was like
range.
anywhere between. That's
Exactly.
why that isolation, the quarantine.
And there are folks that are considered super spreaders who have a lot more virus than by one form of other activity. People who sing or who speak with a very loud voice, who shout,
Right,
are actually more likely to spread
right.
things from the mouth that are potentially infectious.
From the Seinfeld, close talkers. If somebody gets real close,
Absolutely.
talks when they're close to you, you know.
Absolutely.
Maintain the couple of
Which
feet.
is why that distance is important, this mask is important.
All right, put mine back on.
There you go.
So, I guess would it be fair to say in that regard that if you have the smallest of symptoms, if you just have a headache, fatigue, we can test you. We're not going to get overloaded, but if you have the smallest of symptoms, isolate if you can.
Yeah.
But if not, if you're going to be around other people, wear the mask, because if you have that symptom and you can prevent giving someone else, you could save a life.
Absolutely.
Very
Absolutely.
important.
Absolutely.
So, anyway, well, what else? We, overloads, real quick, overloads of
Right,
the
the
system.
biggest thing in the
Do
headline
you think we're
is-
gonna be okay?
Well, you just told us now we only have how many? Three?
We have,
3%?
16
ICU?
inpatient.
three in the ICU.
Three in the ICU.
And three on the vent.
Three on the respirator, on vent, right.
Yep.
So I think we're doing okay for now, but that's the whole point of trying to prevent being overloaded. Because if you get overloaded like they did in Milan or in New York,
Right.
it becomes a real problem.
Yeah, we're fine. I think
I
that
think we're doing
that
okay
if the
right
trend
now.
continues,
Yeah.
and we don't get people to be a little more careful and not touch your face, wash your hands, and wear the mask if they have the smallest iota of a symptom, we could end up we're overloaded. But right now, we think we're gonna be just fine. We don't have a shortage of ventilators, we don't have a shortage of PPE.
Right.
Things are pretty good
But
overall.
still do your part. That's why we're here today, to give you this information so that you can do what you can to help that from ever happening. So, I know that we've had some letters been put in people's mailboxes. We've seen, conspiracy theorists going out in the protests
The
during other
hoax.
events, trying to say that this was a governmental, suppressive motive from either our country or another country to completely dismantle our economy. What do you think?
Well, I don't want to get political here, but Brazil president just was reported positive today. I don't think we're that smart. Every serious scientist has confirmed that there's no way this could have been a manufactured virus.
Right.
So I think it's basically almost like a political statement. Of course, it's not a hoax. I mean, this is real. Anybody who doesn't think it's real, you just look around you.
There is a lot about it out there, and I can understand if someone's not been affected, but I personally had a friend who got this, and I can tell you right now that it's no joke, and it's a lot worse than the flu. And if a person has a comorbidity, they're gonna fare a lot worse from this than they will from the flu. So it is certainly not a hoax, it's legitimate, and we could obviously prove that. So it's a shame that people are saying that, because it's real.
Yes.
And it's not going anywhere, so.
All right,
It's
not
going to
going
be with us
anywhere.
for a while, yes.
So do your part, wear the mask. If you have the smallest iota of a symptom, please wear the mask and isolate. Get tested, we can test you. In the meantime, do all those things and stay Sea River strong. Give me
There you
the
go.
Sea River salute.
Thank
Stay
you.
strong.